of the most common symptoms of plantar fasciitis is feeling tightness, restriction, and of course pain in the bottom of the foot and in your calf and lower leg musculature. Everything just feels tight and stiff. Our first inclination to relieve the tension is to stretch. In fact, that's what we're told to do to get relief. However, stretching without addressing the primary cause of your inflexibility is virtually ineffective, and you are disregarding the most important factor in increasing mobility. This one thing that would allow us total freedom of movement is addressing our fascial system. When we are feeling tightness in our muscles, what we are really feeling is restricted fascia. Fascia is the connective tissue that wraps and surrounds every single thing inside of our body, including our muscles and other soft tissues. When your fascia is healthy, you can bend and twist and stretch fully. When it's unhealthy, it's rigid, inflexible, and very painful. Most people with plantar fasciitis have unhealthy, restricted fascia in their feet and calf muscles, and this can be the primary cause of your plantar fasciitis symptoms. In this video, I will demonstrate for you exactly how to release fascial adhesions using a stainless steel fascial release tool. Also, later in the video, I will be sharing what actually causes fascial adhesions and how to prevent the development of unhealthy tissue. I'm Dr. Angela, and I'm the Plantar Fasciitis Doc, and I'm all about helping you resolve plantar fasciitis at home. Now, let's get into it. In my plantar fasciitis recovery program, my goal is to arm you with strategies to restore your flexibility and mobility in your foot and lower leg so that you can return to the activities you love, whether that's running, walking, tennis, pickleball, or just having a full day of being pain-free. Addressing fascial restriction is step number 5 in my free guide, and it's one of the most critical steps to resolving your PF. When fascial release is used properly and consistently, you feel noticeable instant relief, and your flexibility and mobility and pain intensity improves significantly. Our fascia should freely glide without sticking or adhering together. Fascia is incredibly important, and if it cannot stretch, it limits our overall mobility and leads to many injuries, including plantar fasciitis. If this knot represents an area of restriction, can't you see how just stretching wouldn't remove the adhesion? The way that we release these adhesions is with targeted strokes using the specific tool that helps to locate and identify adhesions quickly. Fascial release is also called muscle scraping or fascial scraping. Before we get into the demonstration, I think it's important that you understand what causes these fascial adhesions. Adhesions form when the load placed on the body is greater than the capacity of the body's tissues to handle that load. In other words, if you put more stress on the tissue than it can handle, the response is a breakdown of that tissue and adhesions develop. With plantar fasciitis, this added stress can be from a sports injury, overuse, an awkward gait pattern, or even wearing the wrong shoes. We mentioned earlier how adhesions cause pain, tightness, and lack of flexibility, but it also leads to muscle weakness and diminished blood flow. But guess what? This technique helps to restore all that. Here's what you will need. I recommend using a muscle scraping tool. It has a beveled edge that is specifically designed to help you locate and remove adhesions. You will sense a vibration when you scrape over an adhesion. You will also need some type of emollient so that the instrument will glide more easily. I will be using an essential oil blend, but you could use coconut oil or any type of lotion. The tissues that we will be working are the plantar fascia, which is the bottom of the foot, the calf muscle group, which is the gastrocnemius, which is the upper calf, and the soleus, the lower calf, and your Achilles tendon. Let's begin by applying an emollient to the tissues that we will be working today. The bottom of the foot, which is the plantar fascia, the upper calf, which is the gastrocnemius, the lower calf, which is the soleus, and the Achilles tendon. Using your fascial release tool, begin to scan the bottom of the foot, which is the plantar fascia. The plantar fascia is a thick fibrous connective tissue that originates here at the calcaneus, your heel bone, fans out into the foot and attaches at the forefoot at the metatarsals. When people have plantar fasciitis, one of the most distinctive features is a pinpoint tenderness right at this area. So we can start there. Using very light to moderate pressure, begin to scan, looking for areas or changes in tissue tension or tissue texture. Whenever you find adhesions, the tissue will feel rigid or even crunchy. The tool, you can often sense a vibration, and that is an indication that there is adhesion development in that area. When you continue to apply pressure, we are attempting to increase blood flow to the area and then break up or disperse these areas of fibrous formation. We'll cover the entire bottom of the foot. Anytime you feel areas that are tender, spend about 30 to even 60 seconds on that one area to release it. And if it's really tender, lighten up your pressure. You don't want to go too deep. To further increase flexibility, you can stretch the tissue. So shorten the muscle, then lengthen it. Shorten and then lengthen as you're working it. The next area we will be working is your calf muscle group. We're going to start with the gastrocnemius. It's your upper calf, and there's two heads of the gastroc. There's a medial head and a lateral head. The medial head of the gastrocnemius is often involved with loss or limited ankle range of motion, and that's one of the primary causes of plantar fasciitis. So we definitely want to release this area. There's also fascial connections between our calf muscle and our plantar fascia. So we definitely want to move further up the kinetic chain here and work the gastrocnemius. Whenever you feel tenderness, spend a little bit more time there. If you feel any changes in tissue texture, you'll isolate that area and spend about 30 to 60 seconds. I do have a little tenderness right in this area, so I'm going to show you how I would release that. Then we'll move to the lateral head of the gastrocnemius. We're just scanning the whole area of the calf muscle group. It doesn't take a lot of time to release this. When someone gets a massage, they think, well, I need 30 minutes in a certain area, but that would be too much for using fascial release. The soleus is the lower calf. The same thing applies. If you want to further increase flexibility, you can shorten the muscle and then lengthen the muscle while you're working that specific area. The last area that we will be working is your Achilles tendon. I would be very cautious about your pressure here. It can be very tender. So just lightly work this area. I would also work some of the areas around the heel bone and then even into the ankle joint. One of the most common causes of plantar fasciitis is limited dorsiflexion, which is bringing your toes towards your knee. And kind of scanning through here and see if there's any restrictions. Once you feel the tissues getting warmer and pinkish in color, that's an indication that you have stimulated small vessels and increased blood flow in circulation. At the end of each session, your foot and calf should feel lighter, looser, and warmer. You may also see small red dots along with the redness. This is evidence that scar tissue and adhesions have been released and broken up. It's a good sign. However, you'll want to wait until the redness has resolved to start another session. Repeat the treatment every 2 to 3 days. Now that would be around 2 to 3 times a week, and be consistent for as long as 4 to 6 weeks. It's very important not to overtreat the area. You must allow time for tissues to heal before you scrape again. Expect to feel some soreness in the treatment area in the following days. It almost feels like a bruise. Again, this is normal and is an indication that your treatment was successful. Just a few reminders. Number one, it's important to use light to moderate pressure. Deeper pressure isn't any more effective and can lead to deeper soreness and will prolong the time before you can scrape again. Number two, expect the tissues that you have treated to be sore and tender to touch for a couple of days following the treatment. Number three, you may see redness or small red bumps and even some mild bruising, and this is normal and expected. However, you must allow the tissues to heal before you treat again. If you continue to see bruising, your pressure may be too deep. Following this treatment, the next phase of recovery from plantar fasciitis involves targeted strengthening and mobility protocols for the intrinsic muscles of the feet and the lower leg. And you can find these specific exercises in my free guide where I show you the steps to resolve your plantar fasciitis at home. Also, be sure to watch my next video on more strategies to resolve your plantar fasciitis.